The pandemic has dominated the health conversation in our country since we first heard the term COVID-19.
Since the pandemic, there has been an increase in depression and anxiety.
This week, we'll show you why in 2022 that is still the case and how the impact goes beyond the virus itself.
I grew up on fried chicken and burgers and fries.
How obesity is back in the spotlight and the shortage that could make America's mental health crisis worse.
I want to be here for a long time for my grandkids.
This is The Race. It really wasn't that long ago when we needed clothes or electronics, we would go to the mall. Online shopping's obviously changed that. The internet has also made it so we can do visits with our doctors online. But there will always be that need for in-person care. And that is creating an opportunity to make going to the mall a big part of our lives again.
You talk to anyone here, they'll tell you, this is where I came on the weekends to hang out with my friends.
For decades, it would have been hard for Joy Stiles and me to do an interview right here.
I mean, there were cars here every day. The Macy's was open. We had a JCPenney's, a Dillard's, and a Sears. Those were all the anchor stores.
But today outside the Global Mall at the Crossings, we don't have much company. This mall in the heart of the district she represents on the Nashville Metro Council closed in 2019.
People have been complaining in the community for years about how this has been sitting here empty.
Today on site, there is a library and a community college.
It just was like a very eerie feeling to know from when it used to be a vibrant mall to being very empty.
As well as the community center Thomas Floyd runs, where you can see inside the mall through this big window. Yeah, it's just pretty wild. I could see caution tape and an empty food court, but Stiles tells me one day we'll see patients coming to see their doctor.
It's going to afford everyone in the area the opportunity to be able to get to a medical appointment within 10 minutes.
The city of Nashville is buying the mall and plans to lease 600,000 square feet of it to Vanderbilt University Medical Center, which turned an old mall about 20 minutes away into a healthcare facility back in 2009.
They don't have to build a new facility. They don't have pour a foundation. They don't have to dig. It's right here.
Medical facilities that really, you want privacy. You don't want a lot of windows. So depending on which parts of the mall you're taking over, malls are pretty convenient.
Few people know more about what we'll do with empty malls than Georgia Tech architecture professor Ellen Dunham Jones. She's kept a database on stuff like this for more than 30 years. She says almost a third of 1,500 former mall sites across the country are being repurposed beyond retail, becoming office space, apartments, and in the case of the 35 on this map, places for people to receive medical care, housing clinics and other care facilities. Since the pandemic started, she says a dozen more have announced plans to use empty space for healthcare.
I realize that for most people, they don't know what health equity is or have never heard of it, but they definitely know it when they see it.
I asked Tennessee Justice Center's Kanika Young if there's anything we're overlooking as medical care enters the mall space. Her group works to make sure everyone's access to healthcare is fair.
You know, with over 15,000 uninsured people in this zip code alone, will just having the facility actually meet those growing community needs.
She says improving transportation is also key. Vanderbilt told me they don't have specifics on what they'll put in this mall space and that it's years away from seeing patients. Councilwoman Stiles says a performing arts center is also part of the plan.
This is going to be, yet again, a focal point for the community, but in a whole new way.
Growing up, you might not have believed that one day, so many of the places we went to shop, hang out, or get your ears pierced would look like this. But now, they're poised to play a big role in our lives again.
I'm Joe St. George in Washington. And while we're talking about health, perhaps there's no bigger healthcare debate right now than abortion, where rallies on both sides continue at the Supreme Court. as the country waits to see if the leaked opinion to Politico overturning Roe v. Wade will be the actual opinion of the court when the justices decide to disclose their decision. There's no indication of when that might be. While Chief Justice John Roberts has confirmed the leaked document is real, he also said it does not represent a final ruling.
Of course, it has been speculated for months that the Supreme Court could overturn Roe, which simply restores the authority to regulate abortion back to state governments. Conservative-leaning states will likely pass new restrictions. Liberal-leaning states will likely expand abortion access. However, one question being asked today, could President Biden, could Congress do anything to respond to the Supreme Court?
In short, the answer is yes. Democrats in Congress could try and pass a law to codify the right to abortion into federal law, starting an entirely new legal fight. However, it's doubtful Democrats have the necessary votes to do that right now. The Senate is split 50-50. Conversations have also started to change Senate rules so that abortion rights could pass in the Senate with fewer than 60 votes. For the moment, though, that appears to lack the necessary support, too. Meanwhile, down Pennsylvania Avenue, President Biden has already indicated he might try to do something on his own when the actual opinion comes down. He has directed his Gender Policy Council and the White House counsel's office to prepare options for an administration response. The president saying, quote, "We will be ready when any ruling is issued."
The pro-life movement is not going to stop.
Carol Tobias is president of National Right to Life, one of the largest anti-abortion groups in the country. Recently, she told me even if Roe gets struck down, her work won't be over. New legal fights will emerge, likely ones involving the White House. For instance, there's a growing push by women's rights groups to promote abortion pills that could be delivered discreetly in the mail. Stopping that, she admits, will be tough.
It will be hard to catch.
Abortion is oppression!
As for the time being, expect abortion to be a major focus of this year's midterm elections. Abortion rights supporters telling me this is going to mobilize some voters.
We really do hope that this draft decision leak really mobilizes people to take action.
In Washington, I'm Joe St. George.
I'm Vanessa Bashania. Obesity and other dietary illnesses, they're certainly nothing new to this country, but the numbers of them are rising. And the pandemic certainly showed us just how these make us more vulnerable to other illnesses. However, doctors say that folks are using this time to get motivated and make themselves healthier.
Some gluten-free bread.
Jason Killens is a food blogger running a page for gluten-free options on the road through his home state. And like a true blogger, he takes his audience with him, even during a health scare.
I'm here and I've got to make some changes.
Last month he found out his gallbladder was swollen and infected and needed to be taken out.
You know, being in Arkansas, I grew up on fried chicken and burgers and fries. You know, I'm 50 years old now and I know I can't keep eating the same foods that I've been eating for, because there was a reason my gallbladder shut down.
His doctor says poor health decisions over the years most likely led him down this path. Jason, though, is far from alone. There are about 107 million Americans living with obesity and other dietary illnesses linked to it, like diabetes and heart disease. That's 42% of the country's population, and it's up 30% since 2000, according to the National Health and Nutrition Examination Survey. People living with these illnesses were heavily impacted by COVID. 30% of COVID hospitalizations had to do with obesity, and 20% were people living with diabetes. 30% of COVID deaths were linked to obesity, diabetes, smoking, and hypertension.
Their immune system is preoccupied and is not able to divert its attention to also fighting off infections.
Dr. Joseph Henske is the director of the diabetes program at the University of Arkansas for Medical Sciences. Though his specialty is diabetes, he works with people who are also on the verge of it. 80 million people in America have prediabetes, and a lot of them do not know it. Something he says he has been seeing is a renewed focus on getting healthy.
They stop and they take a look and they say, what can I do? How can I improve in sort of those key areas? Diet, your physical activity, your sleep hygiene, and your stress level. When I talk to patients, I kind of try to itemize those and try to set goals and say, how are we improving in all four of those areas? And if you are, you're going to be able to improve your health without more medication.
And I want to be here for a long time for my grandkids,
The scare that Jason went through has made him make a quick 180. He's hooked up with dietary coaches and even signed up for some 5Ks. He says anyone can take steps to turn their life around.
I would just encourage everyone to think about how long they want to be here and what kind of life, healthy lifestyle they can live.
I'm Vanessa Bashania reporting.
Our nation's youth is facing a mental health crisis. We're asking who's taking care of kids as schools in every state fall short on mental health services when the race continues.